Hello, everyone. Welcome to our first Child Life webinar for 2024. We are so excited to have the amazing Samantha Johnson here today and sharing this amazing webinar about, it's called Child Life Unleashed. And it's really kind of it's really bringing in two different fields together. And I think it was such a beautiful, she has a very beautiful presentation for you guys. Again, we are so excited to have all of you guys attend, spending your time with us for this 75-minute webinar. So Samantha will go over some of her webinar, and then afterwards we will open up for Q&A. If you guys have any questions, please feel free to chat us. You guys are available to chat, and then we will be sure to answer those questions at the very end. Samantha, it is all yours.
Okay, I'm going to go ahead and get started. I'm going to be talking about working as a child life specialist, but also a facility dog handler. I'm going to start with a quote that I love. It says, "I have found that when you are deeply troubled, there are things you can get from the silent, devoted companionship of a dog that you can get from no other source." I'll start with introductions. My name is Sam. I work as a child life specialist 3 at Stanford Children's Hospital. I got my graduate coursework completed at Mills College in Oakland. And then I did my internship at UCSF Benioff, San Francisco, and then started working at Stanford Children's Hospital. And I've been here ever since. That was about 7+ years ago. And then not too long ago, I applied to become a facility dog handler. And got Margie. Her legal name is Margine. I call her Margie. She's 4 years old. She's here in this presentation. Maybe she'll make an appearance at some point, but if not, here's her photo. You'll see lots of pictures of her. She's 4 and she joined Stanford in 2022. All right, so for our agenda today, we went over our introductions. I think it's really important for us to talk about the difference between facility dogs and pet therapy. I'm going to talk to you a little bit about why dogs matter, why it's important to have dogs. I'll talk a little bit about facility dog interventions, what those might look like. I'll talk about assessment, give you some information on like the heads and tails of things and things to consider. And briefly overview like how to get a dog. And then I really want to allow a lot of time for questions because I think it's such a cool topic, and maybe we have other handlers that are in on this presentation and want to contribute. You guys let me know. I'm here for you. But I'm really hoping that like at the end of this session, you understand how research has supported the use of facility dogs or dogs in the medical setting. And also how to integrate medical dogs into your facility, and then also become familiar with the process of applying for a dog. Facility dog versus pet therapy. By definition, a facility dog is a highly trained and skilled dog that's used to enhance the quality of life and education for patients within both the inpatient and the outpatient units. Facility dogs are handled by hospital employees and can be used to encourage goal-oriented interventions with select patients. A service dog is a dog that is individually owned and trained to work or perform tasks for the benefit of that individual with a disability, including like physical, sensory, psychiatric, intellectual, or other mental disabilities. And then there's emotional support animals, which I'm sure you guys have heard of. But their sole function is just to provide individual comfort or emotional support. They do not qualify as service animals under the ADA. And then there's volunteer therapy dogs. So these are dog handler teams that volunteer their time to provide like very short, social, still therapeutic visits. They're typically certified through a therapy animal organization like Pet Partners or Valley Humane Society. And then there's your family dog, which is like a tamed, domesticated animal that's kept as a patient companion or a family's pet. But a lot of people ask me the differences between the use of a facility dog and a pet therapy. So I don't need to like verbatim read my slides, but pet therapy is much more casual. the meet and greets. The facility dogs have a designated handler. They have to work a certain amount of hours in a week. They have extensive training. I have to chart about all my work with the facility dog. Um, they have a ton of commands, like 40 plus. And then the pet therapy dogs, they know their basic commands. They're very safe to be around children, around other animals. They have to pass a good canine citizen test, and they know their basic tasks. Okay, so dogs make people feel really good. We know that, but there's also some scientific research that supports this. That say like the dogs are a therapeutic intervention. They result in the use of a facility dog has been proved to result in reductions in stress hormones, as well as increase endorphin levels. They have positive effects at reducing anxiety and depressive symptoms, and really improving people's well-being. We've seen proof that it increases the use of a facility dog can increase the success of like non-sedated procedures like an MRI. I see this every day, but the dogs are really powerful tools for motivating patients to comply with treatment. I'll talk a little bit more about that in a little bit. And then improving patient, also staff, well-being, but communication, social interaction skills, and really just the overall hospital experience. Dogs are the best, and particularly special in a hospital setting. You would otherwise not expect them to be. Okay, so why do we want to have dogs in the hospital specifically? Yes, they're comforting and they're cute and they make you happy and they bring joy. They make the hospital feel a little bit more humane, less sterile. But they've been proven really to provide an alternate focus from illness symptoms, pain, medical treatment in the hospital setting specifically. They motivate and support patient coping big time. They reduce stress and anxiety by providing that like physical contact. They definitely promote social interaction. Dogs can be used, a great tool for building rapport with patients. They can be used to increase compliance with the medical treatment and medications. They offer a ton of love and acceptance. And they really do reduce feelings of loneliness for patients who might be in the hospital long term and are missing home, missing their pets at home, don't have access to those people and animals that they love. Okay, facility dog interventions. So we use our facility dogs at Stanford for procedural preparation, procedural support, to meet our treatment goals, which I've mentioned. We do a lot of co-treat sessions and end of life. So for procedural preparation, a facility dog can be used to kind of enhance your medical play. You can do a lot of like role play with the dog. So if you're preparing a patient for surgery, we've used the dogs for mask play, showing the patient what they can expect to see and feel, and utilizing the dog almost as like you would a doll. And then inviting that patient to participate, allowing for that teach back moment, right? How much do they understand in your teaching? Are they willing to engage with that real medical equipment as long as the dog is there? We do a lot of like vital signs checking, a lot of medicine prep. Dogs can be really helpful in facilitating the use of teaching how to take medicine. We do a lot of, like, we've built a lot of preparation materials in the hospital showcasing the dog as a patient. So this is what it might look like when you're in the MRI scanner. And we have a picture of the dog. And then procedural support. Dogs can be present during many procedures. We do a lot of like PIVs, anything like non-sterile procedures. We do a lot of like stitches removals, anything really being removed from the body, and the dog is welcome to be there. Some places allow for the dog to be present during PICC line placements and port accesses. We don't do that yet, but can be present for things such as like NG2 placements, which can be very traumatic. We utilize the dogs to help meet treatment goals. So increase coping, motivate a patient to complete their treatment. So are they having a difficult time taking their medications? Are they refusing to engage in other therapies, OT, PT, speech? They're also hugely impactful in terms of pain medication usage. So not using as much pharmacological support if the dog is present to help manage that pain. We do a lot of co-treat. So I'm a child life specialist and a handler, but there are often times where I'll get requests from our colleagues in physical therapy or occupational therapy. A patient is having a really difficult time getting out of bed, is feeling disheartened, discouraged, not wanting to, needs a little bit more motivation. That's where Margie and I can come in. And maybe a patient is really motivated to get up and walk around the unit if they're able to walk Margie, right? So then I can share my leash, and Margie is that motivation for that patient to get up out of bed and move their body, which promotes healing and hopefully a discharge from the hospital. And then we use these dogs often during our end of life care. So our facility dogs can be present during those really difficult end of life conversations, during legacy making activities, and at the time of withdrawal for family support. I'm happy to talk about like specific examples if you guys think that will be helpful. I can kind of go through some of these photos here might be helpful in illustrating our interventions, but in the bottom left photo, this patient was in the ICU for an extended period of time, intubated and sedated for months. And the team really wanted to assess the patient's level of alertness, awakeness, cognitive understanding as they weaned the pharmacological support. And so we used Margie to kind of assess the patient's level of alertness and to support during that weaning of pain medication. She was a huge source of joy for this patient who was hospitalized for nearly a year and missed her pets at home terribly. So Margie was a huge part of her treatment team. We've used dogs before. If a patient is, for example, has just had a brain tumor resection and the team wants to know post-surgery, how was that procedure, how has that procedure impacted their motor function? We can use the dog a lot to assess if the patient's able to use, their right hand to pet or their left hand to pet. A patient's going to be much more willing, in our experience, to exercise the use of, their arm or their hand if they're able to pet a dog versus having several providers coming in, staring down at the bed and being like, let me see you wiggle your left fingers. So that's been really helpful. And then I talked a lot about this already, but just ambulating around the unit, a patient, as we've seen here, much more inclined to get out of bed, to leave the room, to walk the unit if they're able to do so alongside a dog. So Margie's been really helpful. Assessments, we don't bring our facility dogs to every patient in the hospital because they're not all appropriate. for many different reasons, but typically we reserve the use of a facility dog for, and there's always exceptions, but for patients 3 and up. We want to make sure that we're using these dogs appropriately. So the patient should be able to demonstrate like an attention span, that they're going to pay attention to your teaching. So, like if you're doing medical play, the patient's going to be able to pay attention to the medical play that you're doing with the dog, just because you want to make sure that it's a really good use of your time, the patient's time, the team's time. And then coming in for maybe doing that medical play after you do that teaching, right, alongside the dog. You have to be really mindful. I never bring Margie with me when I first meet a patient and a family. It's not any of the first things I say about myself, like, oh, I also happen to be a facility dog handler. I first introduce Child Life Services. I talk about our purpose on the unit. I talk about how we can help and support their time in the hospital. But you always need to be mindful of fears of dogs. I previously worked in a trauma unit, and so we would get actually multiple dog attacks and multiple dog bites to our unit. So it was very important for me to assess if a family, a patient was fearful of dogs. We never know what has happened in the past. And then I never brought the dog in initially, if I was working with a patient that had sustained an injury from a dog. And then you also need to be mindful of allergies. So I always check with patients and families before I bring the dog into the room. Do you have any known allergies? Sometimes a patient is like, no, 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 no. And then their mom has like a significant allergy. So you just need to be mindful of who's in the room. As much as the patient wants to see the dog, we're not able to bring that in because we don't want to jeopardize mom's health. In those moments, like if a patient is just so eager to see the dog, I can do like a drive-by room visit from the door, and that's been helpful. Better than saying a hard no. Okay, on that same note, there's a lot of things to consider when having a facility dog. So you have to be really careful to mind the infection control policies. There's a lot of factors in place for good reason, right? We work at a hospital. We need to be mindful of our cleanliness, of spreading germs. The dogs need to be bathed weekly. They have to have daily grooming. Anyone who interacts with the dog needs to perform like hand hygiene, so using sanitizer before and after. We typically have like a protective barrier, so like a blanket that we put. You can see in this photo, the patient has her blanket from home. It's the pink, the colorful one underneath. And then I've put that hospital blanket to serve as a barrier on top, so that Margie's still able to be on that bed with the patient as she rolls to surgery, but she's not shedding her hair on her blanket from home. It's just another way that we keep things clean. You obviously can't go into patients who are on isolation, who have open wounds, and also specific populations, like stem cell. So you have to be mindful of those individuals who are neutropenic or whose immune systems are compromised, and not bring the dog in. You have to think about the risk and liability concern. So what I mean here is that handlers are responsible for the dog's behavior at all times. And so you have to be very careful in your interventions. You have to make sure that dog is maintaining their training, understand that you are liable should anything happen. The patient and family factors, I've spoken to a little bit, but being mindful of allergies, being mindful of fear of dogs, right? We see the dog bites. If you're not in a setting that is private, so if a patient doesn't have their own room and you're meeting with them in like a pod-like environment, you just want to be mindful that like you're creating a barrier using the curtains in the room, um, just to allow for privacy, but also that infection control reasons. Um, and then time management. So I'll talk a little bit more about this again, but if you have a dog with you as a child life specialist, and I'm not saying always, but typically your interventions are going to be longer than they would if you didn't have the dog with you. Um, it's another topic of conversation. A lot of the times, patients and families want to know, like, oh my gosh, how did you get this dog? Tell me all about her. What does she love to do? What are all her tricks? Um, let me have every member of my family touch her. Let me call and FaceTime so and so they can see the dog. So your interventions are going to be longer. You need to be able to manage your time accordingly. Also, staff love a dog. And so it's very hard to get anywhere in the hospital without being stopped multiple times by multiple um, staff members wanting to get some dog love. And sometimes I have to say, I can't stop. I'm in a hurry. I'm running to a procedure. And other times I stop, everyone sanitizes, and Margie gets a lot of love and we carry on. But again, that's going to add time to your day. You have to allow a lot of time for play, a lot of the time for like potty breaks. You are responsible for the dog 24/7, even when you're at work. So just something to consider. Okay, so hopefully I've done my job and I've convinced you that you want a dog. And you want a dog so that you can bring it to work with you. The best. I'm going to talk to you guys a little bit about the dog's timeline, because I get a lot of these questions when I meet with patients and families. But our hospital, Stanford Hospital, is contracted with Canine Companions for Independence. And so they are an organization that breeds and trains assistance dogs. They have a very selective breeding program. They use labs, golden retrievers, and then a cross between labs and goldens. Each canine companion dog spends the first year and a half with a volunteer puppy raiser or puppy raisers. Margie had multiple families. And that's when they learn like their basic commands, and they learn how to socialize in public and in private settings. And then once that puppy is like returns to Canine Companions, it enters what they call professional training at one of their like regional centers. And that lasts between 6 to 9 months, and that's where they go through their professional training. And they learn advanced commands that really will support their work as an assistance dog. And then eventually the dog is matched with a handler. So in terms of you being a handler or wanting to be a handler, me being a handler, I first had to confirm that our hospital had a relationship with Canine Companions for Independence. I knew this because we already had an existing dog that came from Canine Companions, so that was easy for me to confirm. Understanding that CCI's dogs are reserved for people with physical or developmental disabilities, adults who are deaf or hard of hearing, and then as well as professionals in a healthcare setting. Also educational setting, and also the criminal justice settings. Those areas that can, demonstrate that a service dog will enhance their independence or the quality of life or the quality of services. It's a CCI's a nonprofit, and they train these assistance dogs. So when I knew that we had an agreement with Canine Companions and Stanford, then I submitted an application. And it's a long process. You do a telephone interview. They require multiple references, medical references, professional references. And you do multiple interviews. You do virtual interviews, you do in-person interviews, you talk with various people at CCI. They learn a lot about your work, your job, what you're looking for in a dog, what kind of interventions you anticipate using the dog for. That's really important. Um, and should you get accepted, it's typically a 1 to 2 year wait list. I was on the wait list for a little over 2 years. COVID did complicate things a little bit in the sense that their training classes, once you've been taken off the wait list, went from like a class of 15 to classes of 4. So that it made the wait list a little bit longer. But they're still quoting the wait list to be approximately 1 to 2 years. And then once you get invited to team training, you actually go to Canine Companions for Independence campus, and you spend 2 weeks training with a dog. You're typically matched on like the 3rd day of training, but you are there 24/7. You spend the night in their dorms. You learn about how to take care of the dogs throughout the entire day. You learn about their commands, and matched with your dog pretty early on so that you can start forming that bond right away. Okay. I am going to talk a little bit about like the joys of being a facility dog handler, which are so many. I mentioned this, but it's a great way to build rapport with your patients. So patients are typically pretty excited to see a dog in the hospital. They're usually pretty excited to see child life too, but when you're coming in with like a really cute animal at your side, I've noticed that patients are pretty quick to engage. A lot of the times it opens up conversation for, what does their home life look like? Do they have pets at home? And they're showing me videos and photos of their pets at home, and they're talking about how long they've been away from their pets, right? So it's a very good conversation starter, if you will. We talked a lot about how helpful dogs are in motivating patients. They're helpful in providing like new creative interventions. They can help in terms of like connecting with patients in a way that you never could previously. This has been particularly true for my work with our behavior and psych population. A lot of the times patients are angry that they're in the hospital. They're hesitant or resistant to engaging with staff. They're having a hard time understanding why they are admitted. They're refusing to engage. Bringing a dog into that environment can change the conversation, or make that patient feel a little bit more comfortable. Excuse me. Another thing about being a facility dog handler is that you're going to be working just naturally with your company's or hospital's marketing team, PR team, social team. They want to highlight all the stories about your dog's impactful work with patients and families. And then selfishly, you get a highly trained dog who is adorable and does magic in their everyday and is yours. So you develop this incredible bond that's pretty hard to put into words. Like I knew I liked dogs. I've always had dogs. But it is pretty incredible to be able to bring your dog into work and share the powerfulness that they are with your entire patient population. So it's amazing. But then there's also like the tail side of things. So the things that maybe aren't so hot and awesome. You have to understand that you are taking care of another being for 24 hours a day, 7 days a week. There are a lot of out of pocket expenses that you're responsible for. So, vet care, pet insurance, food, treats, everything from, their kennel and their beds and their toys. And should you go out of town, like their boarding, their housing, um, their licensure with the county. There's many things that you are responsible for financially. And then you must maintain that daily grooming, but also weekly like bathing routine, which sometimes the dogs don't love. You have to be able to fit in breaks for the dog during the day, and sometimes that means adjusting your schedule a little bit. Um, you have to understand that you're not going to be able to bring your dog to every patient that you work for just because it's not always appropriate. Uh, Going back to that assessment, maybe that patient's allergic, maybe that patient's neutropenic, maybe that patient's had a previously negative encounter, scary encounter with the dog. Um, so just understanding that the dog doesn't get to go everywhere with you. You have to manage a lot of requests from staff. So even though I am currently allocated to one unit, I currently work in outpatient oncology. Um, because I was previously in the PICU for so long, I'm still getting requests from staff in the PICU, like have this patient that's super appropriate for a dog, and or we're having this patient won't get out of bed, or this patient's refusing to eat, whatever it may be. Like, can you please bring Margie? Is there anything we can do? And so you have to be able to say no, and you have to be able to manage those expectations to that same effect. A lot of the time, staff are offering the use of facility dogs without first checking our availability. This happened literally right before the presentation. Um, I was on the unit, a social worker came up. She was like, I have this patient in clinic. She also brought her sister. They're so excited to meet the dog. I told them Margie was here, wondering if you can be present during. She has a pretty invasive physical exam that she has to undergo weekly. And this social worker had promised that Margie and I would be there. So you have to be able to educate staff on how to speak or not speak about the dog. And then you have to be able to manage those requests, respond to the family, get creative. What can I provide in the interim? Excuse me. Hold on, I see a question in the chat, so I want to make sure I get this. I will read this in just a minute. You have to, I said this before, but you're stopped all the time by staff. So sometimes I'm late to a meeting. I allow myself 15 minutes to get from one end of the hospital to the next, but because I'm walking through like the public thoroughway of the hospital, I am stopped so many times. And even if it's me saying no, like I'm making a beeline for this meeting, I can't be late to this meeting, my head is down, I am focused, that's still taking time to kind of dodge politely. Or somebody's asking me a question about the dog, I'm responding, and it's hard to get anywhere with a dog. And you love that your dog is getting love. Like, that's so important to me. I want Margie to be happy at work. But just know that sometimes it can become an inconvenience. You also have to make sure that you allow time for participating in your hospital or your facilities, wherever you're working, any kind of special events. Obviously, dogs are very attractive at special events, and for fundraising too. So we talked a little bit about those like expenses associated with having a facility dog, and for that reason, fundraising is really important. And those dogs should be at those fundraising events where you're soliciting money for the dog program. Right after this, we have a special event that Margie will be attending in honor of Chinese New Year. So there's a lot of different things you're managing in your day. And then I just want to make sure that I allow time for questions, and also comments here in the chat. I am just, if you guys don't mind, going to read through these really quick. The amount of expenses you're responsible for is surprising, yes. At all of the hospitals I've worked at, there are hospital foundation funds or grants to cover food and fat grooming. So glad you bring this up. It's a hot topic right now. At Stanford, I can only speak to Stanford. We are in the process of really building up our facility dog program. And so we are working to build up those grants, to build up a source of funds to support handlers. We have a little bit right now, but at this time, we are responsible ourselves for the grooming, for the pet insurance, for the vet visits, for the vaccines. We do have contributions for accessories like toys, beds at work, leashes should we need them, collars should we need them, which is great. And yes, our dream goal and idea and what we're working on to hopefully be in place very soon is that we have funds and grants to cover things like those vet charges and that food. But for now, we are responsible. That's not the case at every hospital. I love this. Somebody wrote, the heads or tails analogy is a great one and might help us hospital staff to understand when they say, you have the best job. Yes, I get that weekly. Oh my gosh, you have the best job. Your job's so much fun. And what they might not know is like you just use your dog to support facilitating like a hand mold because the patient died. So yes, absolutely. There's a lot of educating staff about what your role looks like in child life, right? You're going to get that as a child life specialist constantly. Oh my God, your job's so fun. Yeah, sometimes it is. And sometimes it's not at all. And so being able to provide a lot of that education. Is there a reason CCI doesn't utilize poodles within their breeding program? I'm just curious, knowing that, yep, this could help mitigate issues with allergies. Yes, such a good point, actually. It's funny you bring that up. I was assuming before I began this entire process of maybe I want to be a facility dog handler or applying to CCI. I was assuming that it was going to be a hypoallergenic breed, so like some kind of poodle or doodle, because like you say, it does mitigate issues with allergies. But they don't. They only use these labs and these golden retrievers. And I think a huge part of it is because of their temperament. So they are people dogs. So Margie wants to be with humans. She's like so sometimes obnoxiously full of love. And she wants to give nothing but like that physical comfort and touch. I don't know much about the poodle breed, but I can just imagine that the reason they've identified like the labs and the goldens is they're smart, they're easy to train, and their temperament. Great question though. We are getting a dog to join us at the hospital that I volunteer at. Amazing. Yes. I was unaware of the cost for the handler and now want to ask more questions next week when I go in. Of course. Yeah. I want to be totally transparent with you guys. But I also want to make sure you guys understand, like I'm only speaking from Stanford policies and how we operate here. It's different at every single hospital. So sometimes hospitals have grants and funds that cover total expenses for the dogs. That is our goal. That is what we're working towards. That is what we hope to see happen in the very near future. But right now, and for the past, since I've had Margie 2 years here, that hasn't been the case. So it's just something to be mindful of. It's something to think about before you decide you want to be a facility dog, something to ask. Maybe the facility where you're working or where you're going to work doesn't have any dogs yet and it's something that you want to bring forth, like you want to suggest, like, hey, this could be a really powerful tool for our patients and our families. Also bringing up the financial aspect of it is really important. Is the hospital going to help support this financially or not? And if not, how can we source some funds, right? Is there some fundraising we can do? Are there grants that we can write? Because they exist. So excited you're getting a dog. It's going to be fabulous. From Leah, does your hospital require the 1 time a week grooming? Is that something you could ask infection prevention to alter to at least every other week? We are only required, yes, so glad you bring this up, 1 time a month bathing or as needed. Perhaps some benchmarking may help. Yes, this is probably my dad, as I didn't clarify. The grooming, so like we are responsible like weekly for I usually wipe my dog with like pet friendly wipes morning and after my shift. It's not required. But I do like the basic grooming check like daily, like I'm brushing her so that she's not shedding all over the place. I make sure her nails are trimmed. It's not like a forced requirement. What we are bound to do is that monthly, like thorough, like deep clean. Yes, I'm so glad. Okay, I'm sorry, I'm reading this all as I go. They do not use, that's what I figured. So they do not use doodles due to their inconsistency with their temperaments. Yes, I figured it had something to do with temperament. At my hospital, the funding for my position, which is a floating child life specialist and facility dog handler, and the expenses relating to the dog are totally covered. That's incredible. I want to talk to you and see how you made that happen. Also, not your bad about the bath. I probably did not make that very clear when I was first talking. I love your guys' questions. I love your guys' comments. Hopefully all of our expenses relating to dogs at Packard will also be covered. But right now, it's a part of the handler's responsibilities. Okay, do you always take the dog to see every patient on your unit, or do you see patients based on the consults from different units? Ah, such a good question, Lily. So this is also different at every hospital. It sounds like where Leah works, there is a floating specialist facility dog handler position specific to responding to, and please, Leah, correct me if I'm wrong, but consults related to facility dog. Here at Packard, as a facility dog handler in a specific unit, so I was in PICU, now I'm in oncology, I do not take Margie to other units. I do not take requests from the larger hospital. Right now, Margie is an extension of me. So Margie sees my patients, and that can be hard, right? As you're walking through the hospital and the family's like, oh my gosh, my son loves dogs so much. And he's been in the PICU and he just had a heart transplant. And can you go see him? And like, that is so hard to say no to. But right now, we do not have a floating facility dog handler position or CCLS dedicated to work with the facility dog across the unit. So they're only seeing my patients right now. We have dogs in other units, but unfortunately not somebody who is traveling across the units for dog specific interventions. Margie sees my patients, but not all of them. So some of them, you have to be mindful of when you work in oncology specifically, but about stem cell transplant, you need to be mindful of are they neutropenic? So I always check the labs really carefully. I always talk to an MD before. I always connect with the nurse before going in. But really good question. It would be, we would need a whole nother position for somebody to address the consults from every unit. So I love that question, and hopefully we'll have that soon. Are there rules regarding your personal choice of care when she is, quote, off the clock? For example, sleeping in a crate versus your bed. I love this question. When I was at training, CCI was adamant that the dog remain in their crate for sleeping. And actually, uh, many people stray a little bit from this, if you will. So I know many handlers who sleep with their dog in their bed. Margie sleeps in her crate. Margie loves her crate. She feels super safe and secure there. She's also uh, protected from her two baby brothers when that is like her space. She actually will walk to her crate at nighttime and look at us and let us know, like, oh, it's time for bed. It's time to turn off the lights. But I do know some handlers who have their dog plus two others in their bed with them at night. So there's some stray. But I was educated that this is where the dog feels safe, especially when you first bring the dog home. They know their crate. They don't know your home and your house and your family members. So that's just what I've exercised and what she's telling me she prefers and needs. Do I let her on the bed at other times? Absolutely. That's a personal preference. There are some handlers who have very strict rules about the dog not being on their personal furniture, but that's up to you. They are trained to not just hop up on a bed and not just hop up on a couch or a chair or make themselves comfortable wherever they are. There's commands for them. So Margie is able to get up on our couch, for example, when I have her like dog blanket on it. She knows what that is. And I tell her, Margie, up, and I have my hand on the couch. She knows to be in a down position when she gets up. So she knows to wait for my command. Hopefully that's helpful. Where does she go if she is on site and you need to see a patient that does not want to see? Yes, totally. Fantastic question. So Margie has multiple beds in our hospital. So it's really important that if you're going to be a handler, you identify like a safe space for the dog to be when you're not with her. So Margie has a bed in a space with water and toys at my actual like office desk space. She also has a space on my unit. So if I'm in my office and I get a call and I need to go support a patient doing radiation, I know that Margie isn't going to go into the radiation treatment center with me. And I'm at my desk. I leave her at my desk. I have a wall tether for her leash in both of my desk areas. So I have her on her bed. She's got her toys. I usually let somebody know that's there. But she's tethered to her leash in a place on the wall so that she can't like wander. She wouldn't, but she can't like wander and get off and leave without me unleashing her. And then same with on my unit. So if I'm going like bam, 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 seeing one unit here, one unit in clinic, one patient in the day hospital, and I get to a patient who's on isolation but is needing support with a PIV, then I run and put Margie, I again tether her to the wall, have her on her bed. She's very comfortable in that space. I spend a lot of time with her in that space. But it's important for you to identify like several different areas within your facility where the dog can be. It's important for her to also have opportunity for rest during the day. So even though I'm go, 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 I need to be mindful of her. Wow, you've just seen 3 patients in a row or whatever it is. You just played fetch forever with this patient. I'm giving her a break, giving her opportunity for water, and just to like be a dog. So yes, she has. So, and you won't be surprised by this, but there are teams all over the hospital that are like, oh my gosh, you can always put her in my office, and I have a bed for her. And when she can't go see a patient, feel free to drop her off with me. I mean, I've had like every team here offer to house Margie. Um, should I not be available to take her into a patient room? Good questions. When you go assess patients initially, okay, so hopefully I've touched on that a little bit. But yes, I leave Margie on her bed. If I'm meeting a patient for the first time, I don't have her with me. So she'll be on her bed, either at my desk space in the actual office or my desk space on the unit. How do you approach potentially uncomfortable conversations with staff that may be upset when you are not able to follow up on our request or when Margie is offered? Yes, happens often. Staff are pretty understanding. They get that Margie is one dog and that we have tons and tons of patients in a day. So I've never had a staff member be like angry with me, that I can't bring a dog to a patient. I do try to accommodate most requests. So what I have gotten is a lot of like, we need the dog in room 12 right now for X, Y, and Z reasons. And I'm very comfortable saying I'm in the middle of a procedure or I'm in a meeting or whatever it is. So being transparent about what I'm busy with and I can't come right now, but I'm available in 45 minutes, or I can check in with the patient and the family this afternoon. Or are the patient and the family going to be anticipated to come back anytime this week? When's the next time they're going to be in the hospital? How long do you anticipate them being admitted for? So like if I can't make it happen on that day, finding a way to make it happen later so that can appease a lot of like potentially like disappointed. I'd say disappointed. I wouldn't say angry. And maybe that felt uncomfortable in the beginning, but now I'm very, very okay with just sharing my reasons for I can't do it now. And here's why. And finding, maybe some creative solutions for the interim. I can't bring Margie, but here's a coloring sheet of Margie's face. And here's a stuffed animal of Margie. Whatever it is, I'll come back in an hour if you're still here, or I'll see you next week, or however. Requires a lot of education again. Yes, okay, so more questions on the bathing. I do love the bath wipes. There's no special shampoo I use for her. There's dog shampoo. I use I use pet friendly chlorhexidine wipes and also just like natural pet wipes. So she's fine with those. I mean, she gets a little like damp after, but she knows they're coming, and I do those daily. I like to wipe her down before I bring her home from the hospital to my home with young children. That's a personal preference. Then Liz is asking how often and how long per individual patient do they have access to Margie, particularly long-term hospitalized patients? That's a great question. I would say my tip, if I had to, and this varies, it's so individual, but it totally varies per intervention. I'd say when I'm bringing Margie in for an intervention, it's a minimum of 15 minutes time spent. I don't count like, a hallway drive by patients, coming back from getting their weight and height checked and they say hi to Margie. I don't count that as as an intervention. Those quick like one-offs, like, oh my gosh, hi, can I touch her? Can I pet her? But I would say my I can do so much of my child life work, those difficult conversations, that diagnosis education, that procedural preparation with Margie present, and that can be 30 minutes plus. There are kids that are here more frequent. So like there are some kids that might see Margie for 2 times at 15 minutes each, in 1 week. And another patient might just have like one longer session with Margie because, they've relapsed and we're in there talking about that conversation and Margie's with me. So it really depends. You said you work in outpatient. Yep. Can patients getting chemotherapy? Yep. Okay, great question. So yes, the answer to that is absolutely yes. We at our hospital, in per infection control, they've just identified this as, what's appropriate. That our patient has to have certain lab markers. So for us at Packard, a patient receiving chemotherapy, and if they're receiving chemotherapy, it typically means that their absolute neutrophil count, which we call our ANC, has to be above what we've determined is 500. So typically, if they are receiving chemotherapy, their ANC is above 500. And so I'm able to bring Margie. She's so helpful during those like extended infusions. Great question. I'm sure that is different across hospitals, but that's our policy at Stanford. Do you know if there are opportunities to volunteer with facility dogs or programs like this so we can gain experience with this? Oh, I love that question. Yes, I know. I would have loved the opportunity to like see what this looks like, maybe as an intern. absolutely ask your places of like where you're exploring interning at. Like, do you have facility dog handlers? Is it an option for me to spend some time with these handlers to see what their work looks like? And just inquire about whether or not they have like a facility dog program. And if you're able to spend some time kind of shadowing. In terms of volunteer with facility dogs specifically, I am sure that Canine Companions for Independence, they're a very large organization. I am sure that they have opportunities for volunteers. That said, you would be seeing the dogs at CCI and their facilities versus in the hospital. If you volunteer at a hospital already, like maybe in the playrooms, or in the school, you could always ask your supervisors, like, do you guys have a dog program? And if so, are you okay with me spending a little bit of time connecting with that child life specialist, perhaps learning a little bit more about how they use their dog in their work? I'm sure people would be more than willing to share. Leah is responding to me. We are a floating team and receive referrals for 3 inpatient and 2 outpatient units. I love that. So it sounds like this team is dedicated to responding to requests for interventions that involve the dog, which I love. Oh, this is so sweet. She also said she had to go, but her dog's anniversary party is today, so they're hosting bingo. Yes, I'm glad she brought this up. We have a studio program like most hospitals do, and we love to feature our dogs in that programming. So if you're a handler, that's something you may be asked to do, is be on camera alongside your dog. Thank you guys so much. I love your questions. I think they're so insightful.
These were great. I think a lot of people are very envious, Samantha, that you get to have, the best companion, work buddy. So adorable.
She's the absolute best. So if you guys have any questions, my email is here. More than happy to connect further.
All right. Thank you guys so much for attending, and we will hope to see you at our next webinar. Bye.
Thank you guys.